Hi, this is Dr. Ganeshakrishnan Iyer here. I am the Chief Cardiac Surgeon heading the Cardiac Surgery program for Aster Bangalore, predominantly based out of Aster CMI Hospital in Hebal. Today, let's speak a little bit about aortic valve disease and how it happens and what are the treatment options in brief. Aortic valve disease can happen in two ways. One is it can happen at birth, by birth as a congenital defect, which we call as congenital aortic valve disease. Mostly it affects children in the early stages of their life where the valve is narrow. Most commonly it's an aortic stenosis. But more commonly what we see nowadays in adults especially is acquired aortic valve disease. This can happen either because of an infective process called rheumatic heart disease, where the valves get affected by the rheumatic process, and either it can become stenotic or tight, or it can start leaking. In medical parlance it's called as regurgitant lesions. The other way people develop aortic valve disease is called as degenerative aortic valve disease, where because of age and natural process of aging of the valve becomes either stenotic or narrowing. Another cause of aortic valve disease is an infection in the aortic valve which destroys the leaflets and causes the valve to start leaking and develops aortic regurgitation. Of course, this is not a comprehensive list. I have tried to briefly give you the common causes of aortic valve disease. Now, if a patient develops aortic valve disease, what are the treatment available for it? Now there is one treatment called as aortic valve repair or Ozaki procedure, where patient's own tissues can be used to reconstruct the leaflets. However, that is not very commonly done and long-term results of that procedure are not well known. The most common way of treating aortic valve disease is to replace the aortic valve. In replacing the aortic valve, we have got two choices. Either it can be a tissue valve or it can be a mechanical valve. A tissue valve is made from animal tissue. The durability, however, is quite limited of these valves, maybe 8 to 10, maybe 15 years. Whereas a mechanical valve technically lasts a lifetime. However, one has to take blood thinners or anticoagulation to prevent the complications from the mechanical valve being in circulation. There is another option called the Ross procedure, where a patient's pulmonary valve is taken and implanted in the aortic position. Now, which valve to choose in which situation for whom is a very detailed discussion, has to be had with the patient and their family, considering their age, their other comorbidities, what other problems they have, and also have to take into consideration their lifestyles, whether they will be able to monitor their anticoagulation status. So it is not like one size fits all. One has to kind of look at what the patient's needs and what is the best way we can take this forward. Say for example, a patient is 85-year-old, 90-year-old, he is not even physically active. Of course, there are other options called TAVR, where we can replace the aortic valve today even without surgery. So there are options available. If any of you or any of your relatives or family members are affected with this problem, you want to know a little bit more about it, please get in touch with us at Aster CMI Hospital. I am Dr. Ganeshakrishnan Iyer, the Chief Cardiac Surgeon here, and we'll be happy to help you out with any of your problems. Thank you very much.